Sa kabila.
You're done, Candice.
Good afternoon, everyone. We're just waiting for the others to join. So far, we have Abel, Debbie, Zaira, Emily. I'm here with Pressy and Ashley. Let's give them a few more minutes before we start. Hmm. Hey, Debbie, are you by yourself?
So, si Mariela, doon na yun, te.
Oh, Mariela and just Mariela. Hey, Emily, do you want to start?
Yeah, we can get started. Small
Or
group, so one of you are gonna win the gift card.
I know,
Oh, hey, we got Christy. There we go.
Christie's.
It's my chance to win.
I know, Abel, you're up. I feel it.
All
Um, cool.
Um,
Yeah, we'll get started, and then if anybody else jumps in, we'll just add them to the.
Eduardo has joined.
Okay.
Hey, Eduardo, who's with you?
My mom, Mariella, and then Francesca as well.
Okay, perfect.
Mm-hmm.
All right. Yeah, I guess we can start.
All right. We'll check attendance at the end too and see if anybody else joined.
Okay.
Let me see if I can remember how to share my screen.
Okay. Okay. Say okay. Hindi ko siya marinig.
All right. Can you guys all see the slide here?
Yep.
Cool. All right. Today we're going to chat about HIPAA, confidentiality, and patient privacy. This is another one that the state kind of wants us to touch on every year. So we'll probably make this like an annual one. It might not be the most exciting, but I'll try to make it easy for us and have some good information. And I know we did some stuff in Relias, so I think you guys have a good understanding of HIPAA. And for the most part, I see you guys do a great job of it. So we're just going to cover some key points, and hopefully it won't be too boring. Okay, so HIPAA is this act. I'm sure you guys have all heard of it. It's the Health Insurance Portability and Accountability Act. Basically, what it is it's just saying that we're going to keep our patients' privacy, their records, everything confidential so that it's not being accessed by people it doesn't need to be accessed by. It covers all healthcare providers, so it covers us in the group home. It covers like if you go to the dentist, if you go to the hospital, anywhere, people know what HIPAA is and they're following it. So, anywhere that you yourself go to the doctor, you're likely covered by HIPAA, and your records are safe. So we need to kind of maintain the same standards that everywhere else does. Another word you need to know when we talk about this is it's called PHI, or Protected Health Information. That just means there's certain things in a patient record that are considered covered, which means that they're covered under HIPAA and we have to protect them. And that means oral, written, and electronic. So we can't go out and say patients' names to other people, but it's also anything written. So if we have a written document, if we print something off the computer, that's protected as well. And electronic, like emails and things like that, are all covered under this protected health information, and we have to make sure that it's kept private under HIPAA. This is the standard that we follow to protect the health information of our residents. So we're following regulations set forth by HIPAA. So what that is, the protected health information, the things that we need to make sure that we're protecting is really anything that can identify a patient that's living in our group home. Those things can be like addresses, dates, dates of birth, phone numbers, social security numbers, medical records, their insurance plan numbers, like on their insurance card, their A number, medical records, and photographs. So anything that can be used to identify one of our residents, we need to make sure that we keep it confidential and we keep it safe so that it can't be accessed by somebody else. Because this, and we've seen it happen. I mean, it just happened with Darren not that long ago, where someone kind of stole his bank account and we had to, take all these steps to help him get his money back. So it's like this population, elderly, is like people like to scam and take advantage of them. So we need to be extra cautious that we're making sure that all of their information is kept safe. So there's this other part of it called the minimum necessary rule. So that means that anybody working with our patients, anybody on a care team, They only should have access to what they need to know to fulfill their assigned duties. So we shouldn't be, telling them things just because it's interesting or because you think they might want to know. They should only have information that pertains to what they're doing with our residents. So that goes for like our caregivers. But that also goes for like people who come in the home. So I just thought of an example down here. So like, let's say like a new CNA comes in to start working with a patient at Blue Sky, and she's just doing showers. What kind of information do you think that CNA might need to know to do her job?
Anyone?
I call you out. There's only like 5 of you.
I guess we wanna educate the CNA about the resident's physical condition,
Hmm.
what he or she might need, if she requires personal care or direct.
Yeah, it's probably mostly going to be like their functional status. Like, can they stand? Do they need a Hoyer? Like anything that she knows to give this patient a shower. Maybe wounds, if there's some wounds. Maybe meds. If there's a med that makes them dizzy when they stand up, they might want to know that. But in this example, the CNA wants to know if we can look up his chart to see what address he was at before, because she thinks he might be her neighbor. Do you think that we should provide that information?
No.
No, because it has nothing to do with what she's doing. She's just curious, which people are curious, but that's the type of minimum necessary rule. She doesn't need to know that to do her job. We shouldn't provide that information. If we did provide that information, that would be a violation of HIPAA because we're giving more information. We're not protecting our patient's information. But we do. We share protected information all the time. We all do. When doctors come in the home, every day we're probably sharing patient information with people, and that's okay because HIPAA does allow us to share information with people who need to know it. So there's 3 main reasons that we can share protected patient information, and one is for treatment, and that's probably what we do, I would say 90% of the time. Us as caregivers and staff members are sharing information for treatment. So like if a doctor comes or a dentist comes, like Karen Henderson comes all the time to see her patients. If she wants to pull up, she wants us to print the MAR for them to see what meds they're on or to review their meds or whatever, or vitals, like that's completely covered under HIPAA because she's providing care to the patient. She needs to know that stuff to provide the best care for the patients. Same thing if like a case manager shows up and she wants to review they ask for the MAR a lot or vitals or previous doctor visits. That's all covered because again, they're providing treatment to the patient. They're coordinating their care. They need to know those things to provide the best care. The same is like when we call 911 to send somebody out, and they always ask for like the MAR and they ask for like a face sheet. That's all covered because they're providing treatment to that patient. They need to know those things. So that's all fine. Don't ever question that. The next is payment, which you guys don't typically deal with, but like Christy deals with like insurance and things. So, sometimes often you have to disclose some patient information for payment purposes, and that's covered too. And the last one is operations. So like normal things like quality management, like when we do rounds, we talk about patients. Training purposes when we do this, and we have to talk about a specific patient. Auditing, when state comes in to audit records, that's why we're allowed to give it to them because it's covered under these HIPAA. So kind of think if somebody asks you a question or asks for records, like is it covered under one of these? If it isn't, then maybe you should discuss with your supervisor or consider if it's something that needs to be shared. How we can keep that protected health information safe. Really, I see you guys do a great job of this. I haven't had any concerns. If I did, I would have addressed it with you guys because it is important, but I think you guys do a wonderful job of it. I know we do a mix of like hard charts, but we also do a lot on the computer. So we have to consider like both ways. Both are under HIPAA. So both need to be protected. So if we have a hard document, and I always think of like face sheets, I know we print those a lot when we go out to appointments. We need to make sure that those are kept safe. So, take it in like a folder or something so nobody around you can see it, and it can only just be given to the doctor, whoever needs it. But when we're done with those, make sure we're not just leaving them in the van or tossing them in the trash can at the doctor's office, because that's not, anybody could pick that up and see that. We need to make sure that we bring them back and shred them or put them in there. I know sometimes we reuse the same ones, we just keep them in the front of their chart. That's fine. So make sure that those are kept somewhere where people don't have access to it. And in the, we just kind of are updating the offices right now. And I know Cyrus and, why can't I think of the maintenance guy's name, helped hang, a new locked cabinet where we keep all the patient charts. So we need to make sure we're doing that so that if, someone comes into the office, the same with meds, they're locked. Patient information needs to be locked up so that, just not anybody has access to it. So we do that great at all the other houses as well. I know Eduardo has his office locked. Debbie has her office locked with the thumbprint, and then the same at Santa Ana. So just making sure that things are locked so nobody can access those documents that doesn't need them. And then when we're charting on our computers, we want to just make sure that we're not charting where other residents can see. So it shouldn't be somewhere where everybody around you can see. I know we have limited spots sometimes where we can chart, but make sure, residents aren't sitting behind you looking over your computer, that their information is kept private. Make sure you log in and off with your credentials. And when you're not using the computer, don't just leave it open on somebody's MAR. Make sure you're shutting it or logging out so nobody can see that stuff. Reporting, again, I've never seen a violation at Blue Sky. I think you guys do a great job. But if you ever have questions, concerns, or you're like, something's not looking right, talk to your supervisor, talk to me or Cyrus so we can kind of help address it and see what's going on. And then, complaints can also be made to the Department of Health and Human Services or online through the HIPAA complaint portal. We've never had to do that. I don't suspect that we will because we're doing a really good job of HIPAA. But just reach out to me or Cyrus if you need help or have questions with anything with HIPAA. So the other piece of what we're talking about today is patient privacy, which is, I think just as equally important. It does fall under HIPAA, but it's kind of separate. So when we talk about HIPAA, we're really talking about like records and documents. When we talk about patient privacy, that can also be considered, records and documents. But I think we also think of like patient care and how we're treating our residents on a day-to-day basis. So under HIPAA, patients have a right to dignity and privacy in healthcare. This includes privacy during patient care and exams, and treating patients with respect regardless of cultural or personal beliefs. So how do you guys, as caregivers, what are some ways that you guys protect patient privacy and dignity in your homes? What are some things that you guys do to make sure that patients have privacy?
There's visits from like nurses or the doctor who kind of sometimes, or physical therapy, will ask them if they want to go to like outside or if they want to do it in the resident's room where they're away from everybody else and they can have like some one-on-one time without any like disruption or anybody being around.
Yeah, that's perfect.
And another thing is at home we're not supposed to discuss anything about, their personal health information. Even posting it in your own social media account, that's not even allowed at all.
Yep.
So, yep, we want to make sure it's kept private.
Debbie, what do you guys do up at your home to protect privacy?
Here we have sometimes we have counselors. They would speak privately in their rooms to discuss how they are feeling, and nobody would be able to hear what they talk about.
Mm-hmm.
And do not share information to other residents as well, because sometimes they would say, "What is wrong with her? What is wrong with him?" So we avoid that. We do not share those informations with them too.
Yeah, that's a hard one too. Like I noticed like when we have patients go out to the hospital, they care about each other and so they're always like, "Oh, what's going on with so and so?" And it's kind of like, balancing that line of like we can't just, you want to ensure the residents that, they're okay, they're in the hospital, but you can't give out that personal information. So that's a good point too. And I like your point about counseling too. So, in the behavioral homes, so Santa Ana and Colt, another thing that they look at is that we have a designated counseling room. So I do the counseling down there, and yeah, I have to make sure that there's nobody in the, if they want to do it in their personal room, there needs to be, the other roommate has to agree that we can use that room. But we do need to have a designated counseling room, which is why the offices also are our designated counseling room, which is another reason why it's important that those need to be able to be locked and not have protected health information just lying around. Because if I need to use that room to do counseling with a patient and they come in and then there's all this information laying around or posted on the board about other patients, then that's not really a safe counseling room because we're disclosing other patients' information. So just so you guys are aware of that, Cyrus and I make sure that the offices are managed well, that they can be used as a counseling room. But just so you guys know why we have to keep those doors locked. I mean, it's not just the meds, but other things as well. So you guys made some good points, but other things that I see that you guys do to protect patient privacy is knocking and waiting for a response before entering a resident's room, because that is their private space. So before we walk into somebody's room, make sure we knock, make sure they say, okay, it's okay that you can come in. They're not changing, they're not indecent. And that's, us just showing them respect and respecting their privacy in their room. Ensure that doors are closed when patients are toileting, showered, or being provided with care. So that goes like for us, like when we're doing care, like when we're changing somebody, we want to make sure that we shut the door, but also we have to remind some people. I know like VNA a lot, we're giving her a lot of reminders, make sure she shuts the door because she just leaves it open. So we're helping patients protect their own privacy. And I think Cyrus touched on this one. We don't ever want to talk about patients like they're not there. So like, if you need to speak to another caregiver or me or Cyrus about a resident, their behavior, their meds, if they're not being included in that conversation, if it's just something you need to talk to us privately about, it should be private. We shouldn't be talking about a patient as if they're not there, so we shouldn't be saying, oh, so-and-so's having a bad day. They're having this behavior. They're doing this. Like that's a conversation that should be private. It shouldn't be something that's in front of them. And especially not in front of other residents. They shouldn't be hearing us talk about other patients. And I know, we have to do a careful job of this, like when I do rounds, because, sometimes patients come in and out of the living room. So we know, okay, we need to kind of stop talking for a minute because we don't ever want to talk about them. You don't want to lose that like rapport that you have with a patient. And it's happened before where they hear us having those meetings. I know when we used to have Julie, it used to really upset her if she could hear things like that. And we had to make sure that we, it's a small house and it's hard to sometimes find room, but we need to make sure that we're not talking about patients where other patients can hear because it ruins your relationship and it violates HIPAA. And then the last one, which you guys do a really good job of, is ensuring that residents are dressed appropriately and well groomed for the day. Their nails aren't hanging like super long. Their hair isn't disheveled. That was like my biggest pet peeve when I worked in like long-term care is like you would go into a nursing home and there would just be like a patient just sitting there in a Depends and a t-shirt. Like that's not providing them with dignity. You want to make sure that they look good, even though they're not able to care for themselves the way they were, maybe in the past. You want to make sure that every day they look good so that if somebody shows up, they look good, they feel good. Especially if we're taking them on outings. Like we want to make sure that we represent Blue Sky in a good way. I don't want people to see our residents and think, oh, are they not taking care of these people? Because we know we are. So make sure that everybody's looking good. And really, I see you guys do a wonderful job of this. Like girls' hairs are always brushed and everybody really looks good. So great job with those. All right, the last thing I have for us. I want your input. So if you haven't talked, jump in. I want to know if you guys think this scenario violates HIPAA or patient rights or dignity rights. So the first one is you're assisting a patient to an appointment and you accidentally leave their face sheet on a chair in the waiting room. So if you haven't seen our face sheet has their picture, their name, their date of birth, sometimes their insurance number, their social security. So let's say you're going to an appointment and you accidentally leave that face sheet sitting on a chair in a waiting room. Is that violating HIPAA?
Yes, yes.
Yes, 100%. Even though it's an accident, it still violates HIPAA. Anybody could pick up that and know way too much about our patients. So make sure when you're on appointments, anytime you have any of that sensitive information, that you keep it attached to you. I would take it in like a folder so nobody can see it. And when you're done, put it back where it needs to go or shred it. So that way nobody can lay hands on it. When it's with you, you're responsible for it. Our next one is you're changing a patient, but you leave their door open because it's hot. It gets hot in the room. Does that violate HIPAA?
Yes.
Yes, it does. And it just violates their privacy and dignity. Anybody could walk by. Another resident could see them like that. And maybe they don't care. We all know VNA is very, doesn't care. But that's still not right. I don't want another patient to have, see her. That could upset the other patient. And we want to protect their privacy, even if they don't really seem to care. So make sure that doors are always shut when we're doing patient care. Nobody should see another resident indecent. And God forbid, like state shows up, that doesn't look good. And we could definitely get dinged for that. So anytime a patient is undressed, showers, changing, anything, make sure that we're protecting their privacy. And then our last one, a resident is heard sharing with a peer about their medical conditions. What do you think about that one?
Sharing. Care coordination.
It's tricky.
I know, a resident heard sharing with
I
them.
would say no.
Yes. No. We are not allowed to do that. If a patient wants to talk about their health information to somebody else, they absolutely can. But we cannot do that. And we also cannot make them do that. So sometimes I've done groups where like we talk about certain medical or mental health conditions. And I always tell them, you can share if you want, but we can't make them share and we certainly can't do it for them. So that was a little tricky one. That is all I have. It was a little shorter one today. Do we have any, you guys have any questions or any comments on HIPAA? Any like things that are confusing? I know sometimes it can be a little tricky.
So a question, maybe
Yeah.
for the group. Let's say, for example, we have a resident who has a guardian, and then a family member called and asked about his current condition. Are we allowed to talk about it over the phone?
Are you asking me or the group?
Like the group.
Okay, good.
Or anyone.
Yeah, somebody else answer. What do you guys think?
I would think it would matter on who the family member is and like the situation, because if we've never met this family member, then we probably shouldn't be discussing without permission of the guardian.
Okay, perfect.
Yeah.
Thanks, Christy.
Usually we get that stuff from the get-go. Like if we have somebody come in and they're like, we had that with like Leisha, like when she moved in and they had issues with her dad and they told us from the get-go, like, don't talk to dad. If dad calls, it's going to upset her. Like nothing with dad. So usually if there's a family member, like they're saying no, we get that right from the beginning. But yes, if somebody has a guardian, really everything needs to go through them. So if we have somebody asking lots of questions, they can call and talk to the patient, but if they want any information from us, we need to make sure that the guardian is okay with that. And like we've had this with Michael, whose son is kind of reappearing in his life, and who like wants to take him on outings and wants to do all this stuff. Like all that definitely needs to be okayed with the guardian. And at this time, she said she was okay with like visits and starting for them to rekindle the relationship, but definitely no outings until kind of they build up that rapport.
And I think it's one of those things where it's like, why do they need to know this? If they have a guardian, if we're managing all their appointments, if they've haven't seen or talked to that person in a year, why would they need to know all this medical information? So we just got to kind of look at the situation, always double check with the guardian.
Okay, perfect. Thank you.
Come on, Cyrus, give us another good question. That was a good one.
I have a question.
Okay.
And once the counselor came to the house, Philip's counselor, Phillips, sometimes he doesn't want to change his clothes because he wants to be comfortable with pajamas all day long, no? So, and he gets mad when I said, or some other people from the staff say, please change your clothes at 8 o'clock, for example, after yoga. And because you have to be ready to receive the counselor. And he says, no, she's fine with me like that. So, and many times, no, it happened many times. So I said, I talked to, because she told me, no, he says, no, because she told me that that's all right. And I said, and I had to ask her because I said, look, he's saying that you are fine with him wearing like that. And she said, no, oh, well, I said that, that's right. And I said, look, but this is the code of this house. Probably is not that because some visitors are coming and they are all day long with pajamas and it's not fine. Oh, that's okay. I will talk to him. But that's what happened in our house. So I don't know if that's right, what I did or not, to tell her that there is a code. After, I don't know, in the mornings, they have to wear properly. No, I don't know if that's
Well,
right.
no, I like where you're coming from, Mary. I think if we go back to like this slide, I think you still see my screen. Like you're trying to do a great job of making sure that they look presentable, because that's been a pet peeve of mine when I've worked at other places. Is like sometimes people just, they take the easier route, and it's easier not to put pants on people who are incontinent and not to change them out of their pajamas because it's easier. So, we want to make sure that we're trying to make sure everybody looks presentable, but you kind of need to weigh the patient's right, which if Philip wants to be in pajamas, like that's kind of his right. We want to encourage him to change because we know that we don't want him roaming around in pajamas all day. But if that's what he chooses to wear, we can't make him change, especially if they're not dirty. Like if they're soiled, that's kind of a different thing where we're really going to push to get him to change. But I think you're taking a good approach. Like, I like that you're not just letting it go. I think some people would just be like, all right, well, whatever. But you're really kind of encouraging him to provide some self-care, which I think is really good. But at the end of the day, if he doesn't want to change, that's his call. But if he's soiled or if he's dirty, we're going to want to push a little harder. But I think you're taking a really good approach to it.
Okay, thank you.
We got 4 minutes left. Does anybody else have any questions or comments? Things that you've run into with patient privacy or HIPAA or anything like that?
I do have a question. I kind of already know the answer, but just wanting some confirmation.
Yeah.
For example, when Vern went to the hospital when he had that stomach issue, the transportation guy that normally takes him to dialysis, I do recall that he called one time to kind of verify if he would have to take him to his next appointment, which he wasn't able to since Vern was still in the hospital. And he was kind of asking like, oh, what happened? Like, what was it? What was happening to him? Like, how long would he stay in the hospital? I'm assuming like we would have to keep information at a bare minimum with him just due to the fact that he's not like a family member or guardian, correct?
Right. So that goes back to like that bare minimum rule or the minimum necessary rule. So like he, you know, is the transportation for Vern. So he needs to know Vern's not home. Don't come pick him up. You know, we could say he's out of the facility, but yeah, you wouldn't want to disclose like where he's at or how long he's there for. I mean, we would just kind of say he's out of the facility for now. We'll call you when he, you know, needs transportation again, but we don't want to disclose any diagnoses or where he's at.
Okay.
You know, we want to protect Vern's privacy.
Yes. Okay.
But good question.
That's a good point.
All right. Well, great job, guys. Good discussion. I'm going to upload this to CloudCare for anybody who wasn't able to join today. And then we'll do our gift card drawing probably on Monday next week. So, yeah.
All right.
Thank you. We'll have it again next month.
Thanks, everyone. Thank you, Emily.
Thank you, guys.
Thank you.
Thank you.
Thank you.